Welcome back. Last month we talked about a flexion adaptation syndrome, and I gave you a couple of ideas for helping the patient to get through it, and I promise you that this month I will do two treatments to help you with the flexion adaptation syndrome. One of them for the hip flexor, which tightens up adaptively, as well as one of them for the knee flexion contracture. So I'm going to do the hip flexion contracture for you right now, and then we'll stop the film, we'll relocate our positions, and I'll show you the muscle energy technique for the knee flexion contracture. So here we go. You position your patient so that the knee that you're working on is in my hand, okay, in your hand, and she holds on to her other knee, like this. I slide her knee down my thigh until I feel right in here where this hand is, anywhere in the iliac fossa. I'll feel for the psoas or the iliacus muscle to kind of tighten up. And when it goes right there, I say to the patient, just lift your knee toward the ceiling with maybe 20% of effort for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then release and take a deep breath. And then all I do is let that leg just gently slide down my leg, and I do this in such a way that there's no binding of her hip. I don't feel any tension in her hip. I just do it so slow, it's just like stretching taffy, very gently. And I get to a point where I might feel the psoas muscle or the iliacus kick in, and I say, just ever so gently to the patient, just lift your knee ever so slightly. Just, that's perfect. Don't, no harder than that for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, release, take a deep breath. And then again, once again, I stretch, gently letting that leg fall to the floor. I don't even have to push it. It's just the weight of gravity helping that leg slide down and lengthening the hip flexor, the iliacus, the psoas. And I'll do that 4 or 5 times. And then if need be, I'll go and do the other side of the body. Okay, part 2 of this treatment is we're going to now try to work for a knee flexion contracture. We just showed you how to use the muscle energy technique for a hip flexion contracture, and now you can work the knee flexion contracture. So let's say that she has a knee flexion contracture on this side. Since this patient doesn't have it, I'll simulate it by putting a towel under there, and that might be the amount of knee flexion contracture that the patient adapted to because of the fear of falling, as we talked about last month in the clinical pearl. So here's what you do. Without damaging the kneecap at all, you kind of surround the kneecap, you press down until you feel some resistance at the back of the knee, like you're stretching. And then you say to the patient, don't let me push any further. As you and the patient, I push and she fights it. So she's actually firing her hamstring right now, and she's not letting me push any further. And we're having a little fight for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Then relax, take a nice deep breath with the patient. Good. Patient takes a deep breath. And then I gently stretch, pushing toward the table. The patient's relaxed, stretch. And when I feel I'm catching a little bit of resistance, I do the same thing again. I tell the patient, don't let me push any further, and I push and she fights me. Just about 20% of effort. That's all you need for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Release, take a nice deep breath. And as she lets go, we just do some more gentle stretching out that posterior capsule, stretching out the tight hammies a little bit, and that will help you to get rid of some of that knee flexion contracture that's going on. Now, how many times do I do this? I'll do it about 5 times in a row, and I'll go back, I'll do it on both sides of the body if needed, and then I'll have the patient stand back up. And now you can start putting them up against the wall and have them practice standing perfectly erect with their knees straight and their hips straight, and get them used to standing without fear of falling backwards because the wall's there. So in summary, we talked about the flexion adaptation syndrome of the hip flexors and the knee flexors in response to the patient being afraid to fall backwards, so they get the ball started and they start falling forward and they walk this way. And these are a couple of techniques you can use to lengthen out the hip flexors, lengthen out the knee flexors that are contracted, so that the person can stand and walk erect, and then practice with them so that they don't fall over backwards.